Welcome to the 208 on a Friday. The good news is we haven't really had to talk about COVID in a while, but the truth of the matter is it doesn't mean it's not out there in the background. Maybe you've noticed in your world there is some sickness going on across the community, some COVID, some not. But COVID surges seem to match back to school season for whatever reason. Is that a case again this year? Well, today I spoke with Dr. Hahn, the state epidemiologist for the state of Idaho. You remember her. She and I spoke about what the COVID world looks like now. There are some things to keep in mind.
What we have right now is that with COVID, people feel like, the worst is behind us. And hopefully that is true, but we have a lack of interest in the COVID vaccine. We're really focusing on reminding those at high risk, so people who have immune systems that aren't 100%, people who are older, especially 65 and older, that population, to think about getting both a COVID vaccine and a flu shot as soon as they're available. The fall respiratory virus vaccines are not yet available, so by that I mean flu and COVID. Those vaccines will not be coming out until maybe September, October. Keep your eyes peeled for them, but they will both be updated to the new strains of viruses that are circulating.
And I actually just saw a comment come in from a viewer as the story was going. They're wondering about where they can get a COVID vaccine. Reach out to your primary care physician or your pharmacist. They will give you an update on when the newest vaccines will be available in your neighborhood. Also, the wildfire smoke. It's been with us all summer for weeks and weeks and weeks. It seems like it's been a summertime companion, just wraps around us and it's there with us all the time. But I have seen a question online, especially in our region, about COVID, respiratory illness, and wildfires. Dr. Hahn explains the interaction.
I haven't seen any studies on smoke and COVID in particular, but we do know that when your lungs are irritated and your throat is irritated from smoke, you are more susceptible to getting infections. Your body is not able to fight those off quite as well as it would if the air were completely, clean. I'm happy to see that the air quality seems to be getting better, and hopefully that'll stay that way.
So back to the top of the story where we talked about back to school season and COVID kind of showing its ugly face again. What is the science behind that? Well, Dr. Hahn basically told me this is a situation of people getting back into those communal locations, families coming back from vacation, students getting back in the classroom. With more people, there's a higher chance for illness. So again, there are vaccines that are going to be available coming out in the next few weeks into September. Believe it or not, it's already here. Again, talk to your primary care physician or your pharmacist if you are curious about that.